Hello everyone. So in this video, we are going to discuss about the certain questions regarding the immunization chapter. So usually asked questions which are about the cold chain and vaccine stories, then about the vaccine while monitoring, and some of the question is regarding the national immunization schedule of the vaccine, and also the about some individual vaccines like MMR vaccine and the pneumococcal vaccine. These are all the questions regarding the immunization chapter. So most of the questions are short essay type or not short essay, short answers type, and also the one answer type, 1 mark answer type. So we have to study that. Okay. So let's start with the cold chain and vaccine storage. The definition of the cold chain, which is the system of transporting, storing, and distributing vaccines in a potent state at a recommended temperature from the point of manufacture to the point of use. So it is a system of transporting, storing, and distributing vaccines in a potent state of recommended temperature from the point of manufacture to the point of use. And once the vaccine potency is lost, which cannot be restored. So to maintain the potency of the vaccine, we have to maintain the cold chain. So there are different kinds of vaccines, that is heat sensitive vaccines are there and freeze sensitive vaccines are there. So increased temperature or decreased temperature both adversely affects the vaccine potency. So we have to maintain a constant temperature for the transportation, then storing and distributing vaccines from the manufacturing to the point of use. That is the cold chain. So what are the heat sensitive vaccines? The heat sensitive vaccines are the OPV vaccine, measles, DPT, BCG, Haemophilus influenza type B vaccine, then DT, TT, TD, and Tdap, hepatitis B. These are the vaccines which are heat sensitive vaccines. And this is the most sensitive, and the last one is least sensitive. And then we have the free sensitive vaccines like hepatitis B, Haemophilus influenza B, DPT, DT, and TD and DT. These are the free sensitive vaccines. So heat injury vaccines are the live vaccines. Example OPV, MMRV, varicella, and BCG. And the cold injury, the more common than assumed. Example all the T vaccines like DT, TT, DT, WP, and DTaP, and TD, hepatitis B, and IPV. These are the cold injury vaccines. And light sensitive vaccines are the BCG, measles, MMR. So then what are the components of the cold chain? So these are the components like that is personnel for the vaccine distribution, storage and transport of the equipment, maintenance of temperature equipment, and monitoring tools. These are the components of cold chain. That is personnel for the vaccine distribution and the storage and transport of equipment, the maintenance of temperature equipment, and monitoring tools. These are the components of the cold chain. So these are the components, that is equipment, personnel, and procedure. These are the components of cold chain. And in the equipment, we have the for storage and the equipment for the storage and equipment for the monitoring is there. Then cold chain, then we have the personnel. Then personnel, we have the training staffs are there. Then we have the procedure, that is storage protocols will be there. Then about the equipment, we have the vaccine monitoring tools and the cold chain equipments are there. In the vaccine monitoring tools, we have indicators like freeze watch indicators and the vaccine vial monitors. And then we have the thermometers like dial, stem, and electronic thermometers which are there for the vaccine monitoring. Then we have the cold chain equipments like the bulk storage, walk-in cooler, walk-in freezer, and ice-lined refrigerator, and also office practice refrigerators, vaccine carriers, and cold boxes are there. Then about the cold chain equipment, we have electrical equipment and non-electrical equipment. The electrical equipment which can be deep freeze and ice line refrigerator. Non-electrical are the cold box that is large and vaccine carrier is there. So that is all about the cold chain. Then the next short answer type question is the vaccine while monitoring. The vaccine while monitoring, it contains time and temperature sensitive colored label that indicates the cumulative heat to which the vial has been exposed. And it does not give indication of the cold injuries. It is used widely in the oral polio vaccine. It helps health workers to know whether the vaccine has been damaged by the heat exposure. For that, the vaccine while monitoring is used. That is, it helps the health worker to know whether the vaccine has been damaged by the heat exposure. Now, uh, that is earlier it is only used for the OPV vaccine, but now it is used available for all the vaccine. That is vaccine while monitoring is available for all vaccine. നമ്മൾ എല്ലാ വാക്സിൻസിന്റെയും മുകളിൽ അല്ലെങ്കിൽ നമ്മൾ കണ്ടിട്ടുണ്ടാകും ഈ ഒരു വാക്സിൻ while monitoring ആ ഒരു സ്ക്വയർ പോലുള്ളത് സർക്കിൾ. Then the vaccine vial monitorings, which are found either on the label or on the caps of vaccine vials. Uh, then interpretation. How will you interpret by looking on the vaccine vial monitoring? The inner square white or lighter than the outer circle, the vaccine can be used before expiry date. Then if the inner square which matches or darker than the outer circle, the vaccine should be discarded. By assessing this inner square and outer circle, we can compare their color. We can interpret whether the vaccine can be used or vaccine which should be discarded. So that is the interpretation. And advantage is it is a cheap tool to save the children from the receiving ineffective vaccines. So that's all about the two important questions, that is vaccine vial monitoring and cold chain. Then we have to learn about the national immunization schedule. That is lot of the 1 mark answers and the lot of the short answers are also we can be answered by using this national immunization schedule. So at birth, this is the national immunization, that is new national immunization schedule. Um, and the national immunization schedule at birth, and these are the age at we have to give the immunization for the children. That is at birth, then 6, 10, and 40 weeks, then 9, 12 months, and 16, 24 months, then 5 to 6 years, 10 years, 60 years, and also the pregnant mother. So these have to be kept in mind. There is birth, then 6, 10, and 40 weeks, then at 9 to 12 months, then 16, 24 months, then 5 to 6 years, 10 years, 60 years, and pregnant mother. So these should be kept in mind. So we can remember that very well. So in the at birth, we have to give the Bacillus BCG vaccine and oral polio vaccine 0 dose and hepatitis B birth dose. We have to give these vaccines at birth. And at the 6 weeks of after birth, we have to give the OPV first dose, then pentavalent first dose, and rotavirus virus vaccine first dose, and also then fractional dose of the inactivated polio vaccine first dose. And also the pneumococcal conjugate vaccine should also be, the first dose also be administered at the 6 weeks. So this order we have to learn, that is OPV, pentavalent one first dose, rotavirus vaccine first dose, then FIPV first dose, pneumococcal vaccine first dose. Then at the 10 weeks, in this order we have to remember, that is only from the 6 weeks, 10 weeks, അതായത് 6 weeks in the നമുക്ക് ഓർക്കാൻ വേണ്ടിയിട്ട് 6 വീക്സിൽ ഫസ്റ്റ് 3 മാത്രമായിരിക്കും 10 വീക്സിൽ നമുക്ക് കൊടുക്കുക. OPV സെക്കൻഡ് ഡോസും പെൻറ്റാവാലന്റ് സെക്കൻഡ് ഡോസും ആൻഡ് റോട്ടാവൈറസ് വാക്സിൻ സെക്കൻഡ് ഡോസും കൊടുക്കും. ആൻഡ് 14 വീക്സ് ആകുമ്പോഴത്തേക്കും അത് തന്നെ റിപ്പീറ്റ് ചെയ്യും. OPV അതിൻ്റെ തേർഡ് ഡോസ് കൊടുക്കും, പെൻറ്റാവാലന്റ് തേർഡ് ഡോസ് ആൻഡ് റോട്ടാവൈറസ് തേർഡ് ഡോസ്. പിന്നെ ഈ 6 വീക്സിൽ കൊടുത്ത FIPVൻ്റെ സെക്കൻഡ് ഡോസും കൊടുക്കും, അതുപോലെ തന്നെ ന്യൂമോക്കോക്കൽ കോൺജുഗേറ്റ് വാക്സിൻ്റെ സെക്കൻഡ് ഡോസും കൊടുക്കും. പക്ഷേ 10 വീക്സിൽ PCVയും അതുപോലെ തന്നെ FIPVയും കൊടുക്കില്ല. സോ അതുകൊണ്ട് നമുക്ക് റിമെമ്പർ ചെയ്യാൻ പറ്റും. ദെൻ അറ്റ് 9 to 12 months ഓഫ് ഏജ് ആൻഡ് 6 to 24 months, അതെന്ന് വെച്ചാൽ it's time for the MR vaccine and JE vaccine ആയിരിക്കും. And first dose of MR vaccine at 9 to 12 months and first dose of JE1 at 9 to 12 months. And then we have PCV booster. അതായത് PCV സെക്കൻഡ് ഡോസ് കഴിഞ്ഞ് നെക്സ്റ്റ് വാക്സിനേഷൻ ഷെഡ്യൂളിൽ PCV ബൂസ്റ്റർ കൊടുക്കണം. വേറൊരു ബൂസ്റ്ററും അവിടെ കൊടുക്കാൻ പാടില്ല. പിന്നെ 6 to 24 months മീസിൽസ് റുബെല്ല വാക്സിൻ്റെ സെക്കൻഡ് ഡോസും ജാപ്പനീസ് എൻസെഫലൈറ്റിസ് സെക്കൻഡ് ഡോസും ദെൻ DPT ബൂസ്റ്റർ ഫസ്റ്റ് ഡോസും ആൻഡ് OPV ബൂസ്റ്ററും കൊടുക്കണം. അതായത് ഇവിടുത്തെ ഇതിൻ്റെ പെൻഡവാലിൻ്റെ പകരം അതിൻ്റെ 3 കോമ്പണൻസ് ആയിട്ടുള്ള DPTൻ്റെ ബൂസ്റ്റർ ഡോസ് ഫസ്റ്റ് ബൂസ്റ്റർ ഡോസും ആൻഡ് OPVൻ്റെ ബൂസ്റ്റർ ഡോസും കൊടുക്കണം. ആൻഡ് at 5 to 6 years of age we have to give the DPT booster സെക്കൻഡ് ഡോസ് കൊടുക്കണം. So we have 2 booster for the DPT, that is DPT booster 1 at the 6 to 24 months of age and 5 to 6 years DPT booster 2. At the 9 to 12 months of age we have to give the PCV booster only. Then at 10 years of age, we have to give the TD, that is tetanus and adult diphtheria. And at 16 years also, we have to give the TD. അതായത് 10 yearsന് ശേഷം നമ്മളെല്ലാം TD കൊടുക്കുന്നത്. Then for the pregnant mother, we have to give the TD1 and TD2 or the TD booster. In the TD1 and TD2 have to give 1 month apart. And the JE, Japanese encephalitis vaccine is only given in the endemic districts only, and the PCV is also in the selected states or districts like Bihar, Himachal Pradesh, Madhya Pradesh, Uttar Pradesh, and Rajasthan in Haryana as a state initiative. So that is all about the national immunization schedule. So this is the table we showing different vaccines and their route, dose, and schedule, and the site also. So by this we can answer most of the our 1 mark answers also. So for the pregnant woman, we have to give the tetanus, that is TD and TD booster, and also TD1 and TD2. It is intramuscular. It is route is intramuscular, and the dose is 0.5 ml is never. So the site is upper arm. And for the infants, we have to give the BCG vaccine. So the schedule is at birth or as early as possible till 1 year of age. So we have the time till 1 year of age for the administration of BCG vaccine. So the dose is 0.1 ml, and if until 1 month of age, we have to give the 0.05 ml. So, and the route of administration is intradermal, and we have to give on the left upper arm. And the hepatitis B birth dose at the birth or as early as possible within 24 hours. It is BCG is within till 1 year of age we have the time, but the hepatitis B we have the within 24 hours we have to give. Then it is also 0.5 ml, and the intramuscular hepatitis B, the route is intramuscular, and the anterolateral side of the mid thigh we have to give. Then oral polio vaccine, that is an oral vaccine, that is two drops we have to give. Then at the birth or as early as possible within first 15 days. Then OPV first, second, and third dose we have to give at 6, 10, and 40 weeks, and OPV can be given till 5 years of age. Then we have it is also two drops oral. Then pentavalent, we have the first, second, and third dose at the 6, 10, and 40 weeks. OPV first and second and third, and like pentavalent first, second, and third week at 6, 10, and 40 weeks, which can be given till 1 year of age. But the OPV can be given till 5 years of age. Pentavalent, which can be given till 1 year of age. Then it is 0.5 ml. Most of the vaccines which are 0.5 ml. So it is also 0.5 ml and intramuscular and anterolateral side of the mid thigh. Then pneumococcal vaccine, two primary doses at 6 and 14 weeks, not at 10 weeks. Two primary doses are for the pneumococcal conjugate vaccine, that is at 6 and 14 weeks. That is followed by the booster dose at 9 to 12 months. Then again, the dose is 0.5 ml intramuscular anterolateral side of the mid thigh. Then we have the rotavirus vaccine. It is again an oral, that is rotavirus, and also the oral poliovirus vaccine of the oral vaccine. Here, the oral polio vaccine we have to two drops, but here the rotavirus vaccine 5 drops at the 6 weeks, 10 weeks, and 14 weeks. Like that with the pentavalent and OPV first, second, and third. The rotavirus 3 doses are 6, 10, and 40 weeks, which can be given till 1 year of age. Then inactivated polio vaccine, there are two fractional doses at the 6 and 40 weeks of age, like that of the pneumococcal vaccine. The pneumococcal vaccine is similar schedule item FIPV. So the dose is 0.1 ml. The FIPV have the same dose as that of the BCG vaccine. Like so, the author BCG vaccine, other than inactivated FIPV vaccine 0.1 ml, like intradermal two fractional doses, intradermal right upper arm. Then MR dose, 9 completed months to 12 months, we have to give the MR first dose. And the measles can be given till 5 years of age. That is 0.5 ml subcutaneous. So routes is for the 9 months and 12 months of age vaccines like a subcutaneous route cycle. That is the measles, rubella vaccine, Japanese encephalitis. We have the subcutaneous route. That is at the right upper arm, measles, rubella, and Japanese encephalitis left upper arm. And also anterolateral aspect of mid thigh if it is applied as intramuscular. Then vitamin A dose, which is also first dose is also given at the 9 completed months with the measles, rubella, and it is 1 lakh international unit, and the route is oral. It is also so oral route vaccines are the oral polio vaccine, then rotavirus vaccine, and the vitamin A. Then for the children's, we have the DPT booster 1 at a 60 24 months of age, and the dose is 0.5 ml, and the administration is through the intramuscular route, anterolateral side of the mid thigh. And then MR second dose is at a 60 24 months. Then we have to give the 0.5 ml subcutaneous and right upper arm. And OPV booster 60 24 months, we have to give 2 drops like that of the OPV first, second, and third dose. Then oral, this oral. And Japanese encephalitis 2 at 60 24 months, 0.5 ml subcutaneous left arm, if it is intramuscular, anterolateral aspect of mid thigh. And vitamin A second to ninth dose, it is given at the then one dose every 6 months. First at the 60 to 80 months, then one dose at every 6 months up to till age of 5 years. It is 2 lakhs international unit, and it is oral. DPT boosted to at the 5 to 6 years, 0.5 ml intramuscular upper arm, and the TD 10 years and 60 years, we have to give the TD that is rotates intramuscular upper arm. So that's all about the vaccination schedule. By remembering all these charts, we can easily answer many of the 1 mark questions. So then we have to learn certain individual vaccines, because some of the short answers type questions which are based on the individual vaccines like MMR vaccine, pneumococcal vaccine, like that. So we have to learn some of the vaccines, individual vaccines. So first about the BCG vaccine. The BCG vaccine is the type of vaccine is a live attenuated vaccine. And the Danish 1331 strain is used, freeze-dried multi-dose powder form with the brown vials. Because in the brown vials, brown it is the light sensitive, so it is also stored in the brown vials. Schedule is at a birth, a single dose or first contact earlier before the 5 years of age. In the recent schedule, we have to give within 1 year of age. In the doses, 0.1 ml intradermal left upper arm at a deltoid insertion, and dose remains same for all the ages. And the diluent is lyophilized in normal saline only, never with diluted water. And the side effects are the axillary, because we give this intradermal injection on the our left upper arm of deltoid incision. So, is the side effects are the axillary lymphadenitis, and regress on their own, no treatment needed, no anti-tuberculous therapy. And if abscess is there, incisional drainage or aspiration should be done. Then complications are the disseminated TB in the immunocompromised host. And the contraindications are the cellular immunodeficiency. It is not administered with the measles or the MMR, hypogammaglobulinemia, and the severe combined immunodeficiency disease. And the storage, we have to store this BCG vaccine 2 to 8 degrees Celsius and discard if the greater than 4 hours after reconstitution. And uh, the typical reaction at the BCG site, we have to instruct to mother, so it is normal. 5 mm wheel at injection site, that is followed by the no changes for the few days. And then after that, we have the papule in the 2 to 3 weeks, then increases to 4 to 8 millimeter by the 5 to 6 weeks. The heals with the ulceration and scar after 6 to 12 weeks. Then about the DPT vaccine or pentavalent vaccine, DT, Tdap vaccine, TT. Um, the trade, it is a killed vaccine. Then it is national schedule is used as part of pentavalent vaccine. The primary vaccination schedule, that is 6, 10, and 40 weeks. We have to give the pentavalent vaccine. And the components are the diphtheria, pertussis, tetanus, then Haemophilus influenza type B, and hepatitis B vaccine. And the schedule is 6, 10, and 40 weeks, booster at 50 to 80 months, booster at 5 years, and never greater than 7 years. Dose is 0.5 ml deep intramuscular in the thigh, that is ambulatory part of the thigh. Side effects are the more with the DTWP, that is swelling, pain, and fever will be there. Complications like convulsions, encephalopathy, anaphylaxis, hypotonic hyperresponsive episode, hyperpyrexia with the fever, then persistent and high-pitched crying for more than 3 hours. And the contraindications are the absolute contraindication, that the complication with the first dose or absolute complicate, that these are the absolute complication, and the relative complication is the progressive neurological disease, and the storage at 2 to 8 degrees Celsius, and the it has a long-term efficacy. Then about the measles vaccine, MMR vaccine. The measles, the strain is the Edmonton Zagreb virus strain, and the mumps we have the Zagreb strain, and the rubella we have the RA27 by 3 strain. Not Wilstar, the rubella we have the RA27 by 3 strain. Then schedule is MMR at 9 months, 15 months, and 4 to 6 years, or 2 doses at 12 months and 4 to 6 years. Dose is the 0.5 ml subcutaneous in the thigh. The side effects or complication, the mild measles like illness after 7 days, and rarely parotid swelling will be there. And contraindication, it is the complications like anaphylaxis will be there, and the um, toxic shock syndrome due to the staphylococcus contamination will be there. Contraindicated in the immunocompromised pregnant woman, symptomatic HIV with the CD4 less than 15%, and you avoid for the 1 month if the child is on steroids. Then storage at 2 to 8 degrees Celsius. Then diluted is liquid to be used within 4 hours of reconstitution. So that's all about the MMR vaccine. Then about the polio vaccines. The bivalent OPV, that is sapin strain, it is a live attenuated vaccine. Each dose have 2 drops, 1 lakh TZID 50 of type 1 virus. Then the diluent is liquid, and the schedule is according to national immunization schedule at a birth 0 dose, 6, 10, and 40 weeks, first, second, and third dose at a 50 to 80 months, and 5 years we have the booster doses. And this is dose is 2 drops oral. Side effects, there is no such side effects, and the complications are the vaccine associated polio paralysis, and the contraindications are the immunocompromised host and household contacts. Then storage is again at freezer at 2 to 8 degrees Celsius. Monitor with the vaccine while monitoring for the potency. Then the herd immunity, that is high with the oral polio vaccine. Then about the inactivated polio vaccine, it is a killed vaccine, but the oral poliovirus is a live attenuated vaccine, but the inactivated poliovirus vaccine is a killed vaccine. And the strain uses is the Salk strain. In the OPV, there will be sapin strain. In this, Salk strain is used. Then schedule according to IAP schedule. It is given at the 6 and 14 weeks. And dose is 0.5 ml intramuscularly or in the thigh. And the side effects are the major side effects is there is no major side effects are there. It is very safe. And the contraindication, the allergic reaction to previous dose. And storage is 2 to 8 degrees Celsius. Then about the hepatitis B vaccine, the content is killed subunit vaccine, 20 microgram per ml of antigen by the recombinant DNA technique. A schedule is at birth within 24 hours, 6, 10, 6, 14 weeks, or the 6, 10, and 40 weeks as pentavalent, or 0, 1, and 6 months. And dose and route is 0.5 ml intramuscularly in the thigh. If it is greater than 18 years, we have to give the 1 ml. Side effects are the major, so there is no major side effects, and the complications like serious hypersensitive reaction. The storage, we have to store at 2 to 8 degrees Celsius, and the efficacy is greater than 95%. So then about the pneumococcal vaccine, the organism is the pneumococcus or the streptococcus pneumoniae. Disease spectrum are the non-invasives like acute otitis media and sinusitis, and the invasive pneumococcal disease are the meningitis, pneumonia, bacteremia, empyema, and D. So to protect from these disease spectrum, we have to give the pneumococcal vaccine. And the 1, 6, 19, and 5 are the most common serotypes, which is isolated in India. Disease burden, the pneumonia, meningitis, and pneumococcal sepsis, which are the disease burden in our community. And vaccines available are the pneumococcal polysaccharide vaccines. And now we have the pneumococcal conjugate vaccine, that is a subunit vaccine. So what are the example for the subunit vaccine? That is hepatitis B vaccine and pneumococcal vaccine are the example for the subunit vaccine. So now we use the pneumococcal conjugate vaccine. The dose is 0.5 ml. A route is intramuscularly, usually intramuscularly, and at certain times we have to give subcutaneously. Indications are the high-risk children greater than 2 years of age. That is high-risk children are the child is having the asplenia, chronic CNS disease, chronic respiratory disease, diabetes mellitus, CSF leak with HIV disease that is immunosuppressed. These are the high-risk children that is greater than 2 years of age. These are the indication for the giving the pneumococcal polysaccharide vaccine. The schedule is single dose greater than 2 years of age and maximum 2 doses. Second revaccination dose is greater than 5 years of first dose in high risk. Limitations are it is not, that is pneumococcal vaccine is not effective in the children less than 2 years of age due to the immaturity of the marginal zones. More than 2 doses, which can cause the hyper-responsiveness also, do not reduce mucosal streptococcus pneumoniae carriers, so less effective against the otitis media. Only 60% against the uh, IPD. Then the local effects of the adverse effects of the pneumococcal vaccines are the fever, myalgia, and severe adverse reaction is very rare in the case of the pneumococcal vaccine. So that's all about the immunization related question answer discussion on the pediatrics. So thank you all.